Hey, what is up, guys? Welcome back to Confessions of a Doctorholic. I'm Dr. Slayman, and today I want to talk about something that's been weighing on me a little bit. Not in a super heavy emotional way, but in that I don't know if I'm being a jerk or just a tired doctor kind of way. You know that feeling when you've worked in the hospital long enough to start knowing your patients? Not just medically, like vitals, labs, imaging, but on a deeper level? You know who's going to be tough. You know who's going to spiral. You know the frequent flyers. Let me set the scene. We had a patient return to the emergency department. She recently had a tiny hernia repair. I'm talking small. No bowel stuff, just a little fat caught in there. But she came in pre-op saying, I'm in heaps of pain. And because we don't dismiss pain, we decided to operate. Post-op, same story. Still in pain, still distressed. And I know, it sounds harsh. You're probably thinking, wow, Hafsa, you're being kind of a dick. But let me tell you, I've seen so many of these exact repairs. Patients walk out the next day saying they feel amazing. A little sore, sure, but happy, grateful, relieved. This patient, though, came back again. So I'm trying not to be dismissive, like what if something else is going on? And to be completely honest with you, the night she returned was already rough. I had a trauma roll in, one patient actively dying, another one who had already passed. We were emotionally and physically drained. We check her CT scan and guess what? She's got a seroma. Fluid collection, very normal after this kind of surgery, or frequent after this kind of surgery. Body usually absorbs it on its own. It was little, it was like a centimeter. We go to evaluate her and her eyes are closed, not responding. Then suddenly her eyes are open and she's like, I'm in the worst pain ever. She tells us it's on the left side. I glance at her chart and she's got a background of shingles. And I hate to admit this, but internally I sighed. She's like, no meds work. Gabapentin didn't help. Muscle relaxants didn't help. Tylenol, ibuprofen, opioids, nothing. So now we're left in this tricky, messy space. Her labs, normal. Imaging, normal. Exam, benign. But the pain is not. And I get it. Pain is subjective. It doesn't always line up with our diagnostics. But when someone's history includes no-shows, frequent ED visits, and a pattern of medication refusal unless it's strong stuff, you start to question, is this something else? We ultimately told her we didn't think this was anything dangerous. Most likely post-op muscle pain, maybe compounded by chronic shingles, maybe even central sensitization. But I walked away conflicted. Am I jaded? Am I heartless? Am I just tired? What would you have done? I'm genuinely asking because I don't know. I'm trying to care for people the best I can, while also protecting my energy and making clinical decisions grounded in data and compassion. It's a tightrope. So today's confession. Sometimes we too are human. I'm trying not to be that person. But sometimes doctors too get tired. Sometimes we have some background stuff going on. It's not that we're heartless. I'd like to think it's not that we're jaded either. It's just that some nights are a lot.